Just point out it's sparkling water.
To those who are just joining us, welcome. I can see the numbers rising very quickly as people do log in, so I'm just going to wait until we build up to the numbers that we assume will be joining us, which will be somewhere over 100 who've registered. And if you're one of those early ones who've just joined us, welcome along. We'll do some full introductions in just a moment as other people join the webinar. This is the Jersey Chamber of Commerce webinar, our Friday web chat, and we will introduce our two panelists in just a second. And for those who are watching already who would like to ask questions, you'll see a little chat box there, and you can pop those in there, and we'll do our best to get those through. On the related subjects that we're talking about today, we're talking about testing and tracing, and we're talking and having an overview of the health guidelines and the policy with relationship to level 3. And the two guests that we've got in with us today is Tony Moretta. One would know him from Digital Jersey as the CEO, of course, but now with a new job title temporarily, as I understand it, although he's not got the memo yet. And that is Programme Director of Testing and Tracing for the Government of Jersey, and Dr. Megan Mathis. Is it Mathis or Matthias? Because I'm never quite certain.
Matthias.
Matthias. So there you are. I was wrong first time. Dr. Megan Matthias, who is the Group Director of Policy for the Government of Jersey. Welcome to you both. Thank you very much indeed for joining us, and welcome to everyone who's registered and joined us on this web chat. Tony, if I can start with you with regard to testing, something that we've read about all week and I've seen as a very, very popular, and I'm assuming myth from what I've just heard at the press conference with the two ministers. A popular myth is, why, oh, why has Jersey stopped doing testing?
Well, I have to say my job would be a hell of a lot easier if that was true. But fortunately, I'm glad to tell you it isn't true at all. In fact, you know, what I was pleased to see when I was asked to come in about 3 weeks ago now on a temporary, it is temporary. Charlie did tell me it's temporary. I've got it in writing. Charlie asked me to come in and sort of take the lead on helping to push some of the projects over the line. And what I found was an incredible amount of work, hard work that had been done by civil servants who've been working since this all began, every weekend, every bank holiday. And it's really good that we've got to a point where we can tell people what is happening. And obviously, we had a discussion a few days ago, Murray, where I told you some of the things that were happening. And you quite rightly said, how can we get this out to your members? So what I hope to do today is try and keep it relatively brief so people have time to ask questions. You have time to ask questions, Murray. It's to talk about all the different work that is going on about testing and tracing. And there's some very specific things that are being announced today by government that I can give you a tiny bit of a sneak preview of. So when we talk about testing and tracing, there are actually 4 main areas we're looking at. And I'll come back to the first 2 because they're the important ones now about testing. But there are the PCR tests, which are about testing, you know, the swabs people may have seen or even experienced, which will tell you whether you actually have COVID-19 at that point. And the task there is, how do we increase our capability to be able to test more and more people more frequently in particular settings like healthcare, so that you can, if someone, particularly if they're asymptomatic, you find the positive cases, you take them out of the system, and you stop them from spreading the disease to other people. There is then what you will hear referred to as serology tests, or to most of us would understand it better as antibody tests, which are tests to see if you have had it in the past, and therefore try and give you a sort of reasonable assumption. There is a bit of doubt over it, but a reasonable assumption that you're not going to catch it again in the near future, and you probably have some sort of immunity. And I'll come back to those 2 tests, but I want to talk about the other 2 areas briefly as well. The other 2 areas are about tracing. So we talked about the testing, and then you've got the tracing or tracking. Now there is manual contact tracing. So if, hopefully none of you have experienced this, but if you had been tested, if you were a positive, then you would get a phone call from somebody on the manual contact tracing team, and they would ask you, they would tell you, first of all, in a very nice way, I'm told, that you have been tested positive, what the implications are for you in terms of what you have to do, you know, asking if you're symptomatic, health advice, things like that, asking you to self-isolate for the required time. But they will also ask you questions about who you have been in contact with. So they can contact them if you've got family members, for example, asymptomatic, further tests. Now, the good news is that that contact tracing team has actually been doing a very good job behind the scenes for a long time now. We've just doubled the size, more than doubled the size of that team to 55 people across 4 different locations. That's quite a big team already. And we have the capability of expanding that team up to about 90 people if we need to. So that's what we quite often call the manual contact tracing team. Although they are using a lot of technology, we stood up for this project an integrated public health record, which can store the information, keep records, testing and things like that, which they can use to better, as I said, track the disease.
From what I'm hearing from that, you're actually increasing the amount of people that are doing tracing as opposed to decreasing, which of course was where I started with that story to start off with, that the government of Jersey had ordered all this testing equipment and then decided that it was just going to do a very small sample. Actually, what you're telling me is that it's ramping up.
Yeah, well, I've certainly come back to the ramping up of the testing, but it's just to complete the tracing. So that's manual contact tracing. Lots of people have heard about a tracing app. You know, we've all heard stories about the Isle of Wight that's been chosen for the NHSX app in the UK, whether it works or not, whether enough people have got it. So we are looking at that for Jersey. It's relatively early days. We don't really need manual contact tracing. Is actually works quite well in a small community on the island. But obviously, if at some point we can start to open the borders, then you want to be able to trace across a number of different people. Maybe some people have come here, been away. So we are in discussion with a number of organizations, including the NHS. Ideally, with an app like that, you'd want interoperability across countries that we travel with most, so particularly the UK. I will say that there is still a lot of hype about this area, a lot of articles about this. We're in a lucky position that we can wait and see what Apple and Google come out with. We've been in discussions with both Apple and Google. The tracing app has been a joint venture for a while between Digital Jersey and government. And we are talking to the NHS. We're looking at other things around the world. And I've had a few questions about this. We are not planning to develop our own app from scratch. That would take longer. It would be a bit silly. And actually, it wouldn't give you that much interoperability. So watch this space on the app. So I want to come back to the testing, which I know you want to talk about. All right. So what we are able to announce from next week, we will be expanding the PCR testing. So that's the swab testing. And over the next, sorry, apologies, because it's so hot off the press, I'm just reading off a piece of paper I've got in front of me. So over the next circa 3 weeks, we will actually be testing about 8,500 essential workers. And those essential workers, now I'll get back to what we're doing with other essential workers, are going to include mainly patient-facing health and care workers in all care settings. So that includes the hospital, care homes, ambulances, hospice, family nursing and home care workers. It includes police, fire and prison officers, allied health and social care workers, customs and immigration staff, and funeral directors. So they will be able to get, there will be a plan of action to test all of those people in those areas over the coming weeks. And that is in addition to the fact that anyone who is symptomatic and phones up their GP, phones up the health helpline, will get a swab. So that's in addition to symptomatic swabbing. This is a planned measure over the next 3 or so weeks to test those 8,500 people. In order to do that, we are keeping the test center, the drive-through test center that people might be familiar with at Five Oaks, except expanding some of the capabilities of that to enable it to do more testing. We are keeping the home visit units that go out and see people who can't get to a testing center. We are opening, those people who are driving past the airport anytime soon, we'll see some activity there. Early next week, we'll be opening a new, bigger drive-through testing center than we have at Five Oaks outside the airport, which will enable people to go and have those swab tests as well. And we're even setting up a mobile unit which will be able to go out to care homes, will be go out to locations like, say, the prison, will be able to do the testing and the packaging of those tests to go off island. So as I said, we are working on building up the capability starting from next week to get an average of about 500 a day. So that's about 3,500 a week. So that is the PCR, the sort of swab tests of, as I said, 8,500 mainly care workers. And that is to get through all of them. And then following that, that process will continue. Those people will get repeated tests on different frequencies. So some people might get a test every week after that. Some people might get a test every month, depending on their role and where they interact with. So that is the PCR swab testing that lots of people have heard about. Now, we also, when I talk about the antibody tests, so yes, there was a story about that the government had put on hold the antibody testing. All that had actually been put on hold was the idea of a one-off antibody test for the whole population. And the reason we put that on hold is that actually from the survey we did a few weekends ago, you'll have seen the results of that, that proved the medical projections that only about 3 or 4% of the population had been exposed to COVID-19. Now, actually, if you think that, it's not the best use of the 100,000 tests we have. It's not the best use of them to use them if you know that 97 out of every 100 of those are going to be negative. And we also know that those tests are not quite good enough to be able to do an individual diagnostic for somebody. They're actually quite good they're very good. In fact, they won't give a false positive. So if they say you have antibodies, that's very strong, but they won't necessarily always pick up that you have antibodies, certainly depending on when you recovered from it. But they are very good at being able to survey and sort of pick up information about particular groups. And what we are going to be doing over the coming weeks, apologies for sort of going back through this, is we are going to be offering those tests. We're going to be redoing that survey that we did around 500 households. That's going to be done on a monthly basis so we can track that same group. But we are actually going to be offering those tests as well to other essential workers. And what we're going to be doing is we're going to be doing studies using those tests of essential workers that have carried on working in areas other than care, have carried on working through lockdown. So for example, the sort of people you get on that are the sort of teachers that have carried on working in schools, looking after the children of essential workers, utility workers, cleaners, bus drivers, retail staff, and people like that. We will be conducting studies over the next 3 or 4 weeks of different groups to sort of check actually the exposure of those groups. So, and that is going to be running into thousands and thousands of tests as well. So hopefully that will give you an indication that it certainly hadn't stopped. I'd have, you know, a lot more hair than I've got if we weren't doing any more testing.
Okay. Thank you.
So that's probably my initial view, and I'm sure you've got a number of questions. In fact, you mentioned one question earlier on about antibody testing and announcements from the UK.
Yeah, this came in. It was quite an interesting question. Came in a little bit earlier on, and if anyone does want to put a question up, the chat box is exactly where you can do that. You'll see that at the bottom of the screen, and Tony is here to answer those. And Megan, we are going to come to you and talk level 3 in just a bit, but this is all good, fascinating stuff. With regard to antibody testing, now that Public Health England has approved 2 antibody tests, that's the Roche test or the Roche test and the Abbott test, both reputable diagnostic companies, and other tests appear unreliable. Is Jersey planning on getting and using those sort of tests here?
So the short answer is yes. The long answer is the antibody tests I've talked about are the sort of finger prick tests. So you actually give a result within 10 minutes on the spot, so to speak. And as I said, there is a mixture of views about that. Generally, they're very good. They won't give a false positive, but they might give a false negative. And actually, that's the right way around, because you don't want someone to give someone a false sense of security that they've got the antibodies and they act a bit differently maybe than they might do otherwise. But they're not accurate enough that medics would like to use them on an individual basis. What was announced yesterday with the Roche trial was actually a lab test in terms of a blood test result. So we've all been to the GP and they've taken a blood sample and it goes off to the hospital lab and they check for lots of different cases to see what might be wrong with you. What the Roche test was to add that capability to Roche blood test machine, so you could test in the lab, and that is accurate enough that it can be used for that individual diagnostic. What the good news today, certainly I spotted it first thing and started sending emails around, a few others beat me to it, is that the Abbott test had been approved as well. Now, fortunately, the Abbott machine is the one that I'm sure I'm oversimplifying it, but we haven't got a Roche machine in Jersey, but we do have an Abbott machine. I'm told we have some samples to test already in Jersey, samples of the test kit to use. And we are hoping within the coming weeks to have the capability to test thousands of people that way as well. So this is why we're using the antibody test we have and a sort of surveillance of the virus and how it's, may have been present in certain parts of the community. As I said, what we've been able to prove is we've had very low exposure as a community generally in Jersey, which has been very useful. But now with the Abbott test, as we test our machine in the hospital, get that functionality on, then testing for COVID antibodies will become a simple part of a normal blood test. So sorry, I did say that was the long version of the answer.
You did, and you were absolutely right too. The second part of that question, actually, from the same questioner, will businesses be able to have staff tested with one of these to help office returns or people getting back into the economy and the business world?
So that's a good question. I have to be straight. I don't have an answer to that right now. This is being looked at from a public health perspective. As I said, we are testing people in terms of the PCR testing to see whether they've got it. So that will test a much larger number of people who will then have confirmation. In the past, for various reasons, people who had symptoms weren't tested. I think going forward in future, we'll be able to have a better idea for businesses about which sectors may have had higher exposure, as I've said. One thing I think it is probably worth saying, we've seen from the survey we've already done, and it would probably apply for most businesses, say certainly most businesses that have had most of their staff in lockdown, remote working, as say, office job type thing, then actually the chances are a very small proportion of their staff would have been exposed to this, because, as I said, we've only seen about 3% of the population from the statistical study have actually been exposed to COVID-19.
Megan, from a policy perspective, as
Sure.
Group Director of Policy, you must be extremely pleased with how certainly the figures and the initial stats are coming out, because that looks as if we're on the right side of this. Would that be a fair thing to say, without being overconfident?
Interestingly framed. I don't think we can take credit for the outcomes at the moment. I think that's much more to do with everybody's efforts at complying with the strategy and the request to stay at home, the request to physically distance, the request to keep your hygiene standards up, and so on. So we keep coming back to those core things of, yes, physically distancing, but partnered with the hygiene measures as being just, frankly, the core underpinnings of all of this. So one of the phrases that's probably worth picking up in this is, people have asked a few times in the past week whether we're aiming for a second or a third wave like the rest of Europe. And it's really important to say we've done so well. We've not had the first wave. And there is, the measures have been successful. But that does leave us, if you take the test results, the serology survey results that Tony and team managed to produce, that does also, if you look at it from a different angle, leave us with 97% of the population who remain vulnerable to COVID-19 because they haven't had it yet. And that's the perspective that underpins the really slow pace and measured pace of opening up at this point.
We're gonna really talk about opening up in just a few
Sure.
minutes. That businesses, and there was a question that came in. If a business wanted to get all of their employees to be antibody tested today in order to build a team confidence about what potential return to normal working would be like, what are their options at the moment? I'm suspecting their only option is possibly some sort of private testing, although I don't want to go down that road too much with you, because I know that's not what you're on to talk about, Tony, but you can see where business is coming from.
I can. The one thing I would say is it's not really going to change anything if 97% of your staff are going to test negative anyway. And Megan can correct me if I'm wrong, that it's not that this is included as part of it. You know, immunity in inverted commas is not being included as part of any plan in terms of businesses reopening and things like that. Partly because we know how few people in Jersey have actually sort of had it. I think in terms of you say about, yes, there might be some private options, but I would go back to what government here has been advising. This is no different to what Public Health England has advised as well, is that they do not believe these current antibody tests are good enough to give to be used for an individual diagnostic. So actually, I think the advice to businesses, and Megan might change, is to probably, you know, wait and see what options come along. This is an area, like all areas of technology, where it's advancing all the time. I mean, I was speaking to someone earlier today about a trial in a particular UK city where they're going to test all the citizens, and that's a saliva test. So I think right now, the only options available to businesses, you say, would be private. They will be the fingerprint tests. They're not that reliable in many ways, and they're not going to actually, I don't think, help the company say, well, actually, 90% of our staff are immune, so they can stay at work, and the other 10% can stay at home. That's not going to happen.
Right. Thank you for that, Megan. Yes.
Just to build on Tony's excellent points. So yes, our understanding of immunity internationally regard to COVID-19 is still developing. We're assuming it's like other flu-like viruses, of which you build some sort, but actually they come back potentially. So that whole field of understanding immunity is developing hopefully quite fast over the next few months. So you can't confirm it anyway. But just to pick up on something, I suspect the questioner didn't quite mean this, but the idea of testing upon return to work assumes that the threat was there and has now gone. And actually it's an ongoing threat. So if at some stage there are tests that you could begin to use as part of your virus protection strategy, then you'd probably have to think about how you use them on an ongoing basis, not as a one-off. But really, I mean, the underlying point is really important about people's feeling of safety and confidence going back to work. And that does come back to the core guidance that's been put out, which I'm sure we can discuss further. And those measures about helping to make sure that hygiene is there, that physical distancing is there, and so on and so forth.
Yeah. Okay. Thank you for that. Of the questions coming in, Caroline with a question, and we'll come back to some of the points that you were making a little bit earlier for those that have just joined us. Tony Moretta is the director the program director for testing and tracing, and Dr. Megan Mathias is the director of policy. I've got that right, policy director.
That'll do.
Yeah, it's one of your many titles, but it's the one that I had written down. Caroline has said last week those with relevant underlying health conditions received letters telling them to stay at home and not leave their houses at all for a further 12 weeks, starting from the beginning of May. Is the need for the development in testing capability what has been holding back such individuals from greater freedom? So, in other words, we're in a stage where we've got to get things in place first. Is that a fair assumption?
Megan might want to add to that. I would say not directly. I think having a robust testing and tracing regime, I think gives us more confidence. Exiting lockdown, it gives more confidence that if there are any cases that pop up again, there are any spikes anywhere, particularly in areas that, you know, like healthcare settings, as I said, or areas where people are going to come in contact with maybe older, more vulnerable people, that you actually find those out quickly, particularly asymptomatic. I think we do have because the situation has improved in terms of supply chain and capability. As I said, anyone who is symptomatic will get a swab. They'll get a test, whether it's through their GP now, whether that's being able to go to a test center, get a home visit. So I think that situation helps protect the vulnerable, but I don't think it is directly linked to that advice. Megan's probably got a much better informed view than me on that particular point.
You're absolutely right, Tony. No, it's not linked. We have advice particularly for people who are severely vulnerable to complications from COVID-19 out there, and they are the people who have received letters either in a batch that was sent a few weeks ago, or, as the questioner mentions, a batch that was sent out last week by colleagues in HCS because because we wanted to make sure that we'd reached everybody. And the rationale for that is very simply that for the people with the conditions in the severely vulnerable category, they are, if they catch COVID-19, it is quite likely that they will need not just hospital care, but intensive care. And so the recommendation to limit social contact significantly holds for those people. The change in tone of advice, it's no change in advice, but the change in tone of advice that's been coming through in the past week is really recognizing that now we know that actually the prevalence of COVID-19 in the population is so low that we are in for many months of living with the pandemic. So the change is really that recognizing that people have to make difficult choices for themselves in their personal conditions about what's right for their well-being in terms of the balance of shielding at home and having some time outside, how much exposure you want to put yourself through in terms of contact with your family and so on. And so within the broad guidance to stay shielding for the next 12 weeks, which still holds, we hope that, and there's the guidance on the website now says this, we hope that people will reach out to their GP, to their consultant, and have a conversation about how to manage this in the long term, in the coming weeks and months for themselves, because it's such a variety of conditions. We can't really give generic advice beyond that's available. So it's then down to individual conversations.
Okay, questions coming very, very quickly, and people are using both the chat and the Q&A, which is probably the right one to use, the Q&A, I'd suggest. What guarantee, that's one for you, Tony, I think, what guarantee do the public have that their DNA will not be used and profiled as part of the testing, and that after the immediate COVID-19 identification, any resulting test devices are anonymized before being destroyed?
Right, wow, that's quite a detailed question. Which I think I will have to, I'll have to give a politician type answer, so I will take that away. I don't have the answer with me. I'll have to take that away and get an answer. Yeah, I'm not going to try and answer that one because I would be making it up. So I will come back with an answer and provide that direct to you, Murray.
The Group Director of Policy.
Yeah, I'm just thinking, Tony, one reassurance you might be able to give is that the ethics committee process they had to go through for the study.
Well, I wasn't sure whether this was swabbing or antibodies because it doesn't actually say. But you're right. We did have to go for the antibody testing. We did go through the Health Ethics Committee in terms of what we were actually doing and how we were doing it. The one thing I would say is that when this information goes off to the lab to be tested, the lab has a number associated so that we can track back to the individual. But the lab that has it does not have that information. The test result is a positive or negative. That will come back into the public health system. Only the contact tracing team have access to that, and only if it is a positive, so that it can contact you. If it is a negative, then you will get you basically get a text message to say this is for the PCR swabs that you've had a negative result. So you know everything, all the government systems are compliant with GDPR. And the labs are not, do not have the information on the individual.
Okay, thank you for that. Will the speed of testing ramp up in terms of not just people being tested, but the results coming back? So are we going to see faster turnaround of results?
So that is a good question. I won't go into the detail, but we have we've been doing a number of things behind the scenes. So we are taking on an additional lab in the UK, and that is a private lab in addition to the facilities we use for Public Health England. I believe we have a faster turnaround in results. We also have a different logistics solution, which means that we have a later pickup each day from the lab to get over to the UK, the lab in the hospital to get over to the UK, so that they get to the UK labs first thing in the morning. So we have a much greater chance of getting a next day response from a swab. We also have introduced a number of new technologies, which speed up the process once the result is there. So I'm sure it will fill some people on the call with horror that previously the test results have been coming, but I can say this because the Chief Minister repeated this publicly, so I'm not giving anything away. Individual test results have been coming back to the lab here by email in individual PDFs, which have meant that that each one has to be typed in and it has to be checked because it's a medical test and it has to be checked. It's a manual process. And then that information is put on a spreadsheet and sent over to the public health team. The good news is we have now automated that. So that result comes back electronically and goes straight into the system in the lab. And that is now connected electronically and goes straight into the system for public health as well. So all in all, what we're trying to do is minimize the time between you having the swab and you getting a result. I think in the past that has taken 2 to 3 days. What we're now aiming at is next day.
Right, thank you for that. I'm not sure if it's me getting questions or you getting questions, but there's somebody getting a lot of questions. And,
sorry, it's my Teams. That one of the disadvantages of Teams is you close it down and it keeps popping back up again.
I just want to go back on something you said before because it related to a question that did pop up on my screen and it's just lost off my screen now. But the question was related to something that you said earlier on, which was about most people in the population will not have been exposed to COVID-19. Is there anything you can elaborate on that? Was the part of the question in terms of what did you mean by that?
So what we did with the survey we did, so people were seen a few weekends ago. We contacted, and in the end we aimed for about 500 households roughly, and invited those to one of 3 test centres to have the antibody test. Individuals were given the result. That was something else that came out of the ethics committee, that although it wasn't being used as a personal diagnostic, you should actually give the individual result at the time, and they were given advice onto what that means. But that was a way where we had a statistically representative sample of the population, and to be able to see how many tested positive. That information was sent on an anonymized basis to Stats Jersey, and they came out with a report that is on the Statistics Jersey website. Anyone can read it. They can understand the methodology. That estimated, I think the figure was 3.1% of the population, in their view, had been exposed to coronavirus.
Does that say what that 3.1% did, or what they were centered around? Because does it localize it to anything?
No, it just really says that they've had it. It says that percentage of people have had it and have a reasonable reassurance that they have antibodies for that. And that was to test that was really used, I say, as a survey to test the thinking that had gone into the models of how many people had been exposed, and it actually pretty closely matched what the forecast had been.
Right. I think the question was alluding to, it was a very long question, but the question was alluding to those who are likely to be at more risk. But I think that's fairly clear as who is at more risk and who is at less risk. And I just wondered if the two were overlapped at all.
We did have some age breakdowns within that, and again, that I would recommend, if people are interested, go to the Statistics Jersey website and they can read the full report. Statistics Jersey, for those of you who know, work on an independent basis, so they had the numbers. They published the report. We weren't even given a chance to sort of comment on it. That goes out in the public domain like they've done. So if you're interested, there's a very detailed report on their website.
Megan.
Just to follow up, Tony mentioned the sort of the follow-up serology test and that's hypothesis based. So where are there likely to be higher? Is there likely to have been higher exposure in the population, like frontline essential workers, and that's the next phase that you're going into. So it's a series of studies to help us build a clearer and clearer picture.
Yes.
Thank you. A question about immunity, and I think you alluded to this a little bit earlier on when you said about uncertainty surrounding immunity. I think that is still in a lot of people's mind, and I assume also from your testing program, quite a difficult one to overcome, in that you are doing antibody testing and you will be doing more antibody testing, but I just wonder what that antibody testing is telling us.
Well, I mean, there are two different levels. So there is the level of saying how accurate are the tests currently, and I've talked about that. It's whether you do have antibodies. There still seems to be some disagreement in the medical fraternity as to whether if you do have antibodies, you are actually immune. I mean, as everyone on this call knows, we're constantly learning new things. This is the whole point of COVID-19, is it's very new. I'm not a medic. Different medics will have different views. All I can say is the people I have spoken to think actually you have it's not 100%, but you can probably assume if you have antibodies, you are going to have a degree of immunity for a certain time. And, you know, maybe it's like it might mutate. Maybe it's like flu and things will change. You know, you have a jab each year. I don't know enough about that. But it's still one of the many things that people are learning all the time about COVID.
Okay, good. A question that's come here from David, who says, we heard from the ministers that they were looking longer term about borders, ports of entry, and if at some time in the future they're going to be able, and I don't want to put you both in a position of answering a political question, because I know you can't, but if we are to get to an area of reopening borders, obviously there's got to be some thinking about the process behind that and where that goes, and for those also, I guess, returning to the island, because at the moment there's a 14-day quarantine.
So what I would say, I mean, there is a lot of work going on about this, so we can't say anything definitive now. A lot of people like me might have read an interesting article this morning of someone's experience of arriving at Hong Kong on a flight and the different processes they went through. But what I would say is that all the things I've talked about are about our developing a robust testing and tracing capability. And that is around whether a mixture of those antibody tests, the PCR tests, the tracing process, eventually a tracing app. The great thing about building up that capability is you can apply that to different scenarios, such as, you know, somebody arriving at the airport, somebody arriving at the harbour. And so once we have those capabilities on island, then we can develop strategies which are specific to particular use cases. And I think we'll be in a much stronger position. So what I would say is watch this space on that one.
Okay, you know that business is many things, and one of them is impatient. And so I'm bound to ask you about timelines. You're bound to say that, you know, doing as quickly as you can. But given where we were and where we are now, you know, and I know, and Megan knows, there's a huge amount of work being done in the shortest possible time. But can you give us some timelines in terms of where you think we're going to be in the next 2-3 weeks with this testing? Because it does look like we're ramping this up fairly quickly.
So as I said, it's going to be a very busy week next week. So as I said, we'll be continuing with all the things we're doing already, like the existing test center, the mobile units. Next week, we will have the airport drive-through test center up and running, which has a much higher capacity than we've had at Five Oaks, but we'll keep Five Oaks as well and actually develop the capacity at Five Oaks. We will have an expanded mobile unit, which will be able, it's actually the fire command unit, which is the sort of mobile office. We'll have the capability of going around the island. Some of the things I haven't talked about, I talked about changing processes such as IT. At the moment, all swabs, wherever they're done, have to be repackaged for transport at the lab in the hospital. One of the bottlenecks we're resolving there is we will be able to pack for transit those swabs at the point they are taken. So the different testing centers and even the mobile unit. So we're building up that capability. You'll have all of this in place next week. We'll also next week be starting the next phase of the antibody testing as well. So as I said, you're going to be testing over the next 3 or 4 weeks, 8,500 people in terms of the sort of care workers and people like that I listed off. I'm not going to repeat that again, but you're going to see thousands more in other essential worker categories done. So, hopefully I've given people reassurance that there are going to be, we could be doing 5,000 tests a week within a couple of weeks, and that is going to carry on as long as we need it to.
But every time you do one of those tests, it's building up a much better picture for people to make decisions.
Well, absolutely. So you could make the decision that if somebody tests positive on an antibody test within certain categories of workers, then you don't have to give them the PCR test. You could make that decision if you wanted to. And you're right, it gives a lot more confidence that actually we will find any cases if they are there, including asymptomatic. We will be able to respond very quickly to symptomatic cases. Finding those cases quickly enables the contact tracing team to get going. And I have to say, I've come in at the end of a lot of this work to get it over the line. We're all very quick from the outside to criticize government perhaps for being a bit slow and not communicating it. But, this stuff is complicated. There are a lot of different logistical steps, scientific steps, technical steps. It's taken quite a while to get us to this point, and we're going to see the fruits of that next week. But I think people are going to be really impressed once that machine gets going as what our capability is. I mean, if we're getting to sort of 5,000 a week, that's 3 to 5% of the population every week. That's not something that other countries are particularly doing. We're in a good position like that.
Okay, I know you've got to go very shortly. There was a question that literally just came in after we just talked about it, and I think we've answered it from Daniel, who said, can we test people if they arrive in the island, tourists or people returning from a press trip? If you didn't hear that, Daniel, the answer is that there is ongoing work on the structure they're doing now. I think I'm paraphrasing you right, that would help that possibly in the future.
I mean, I think that is the bit, so Megan talked about, and I'm working with fantastic colleague of Megan, Steve Skelton, who's done a lot of the strategy work on testing and tracing. So my job's just to deliver it. I'd let somebody else do the strategy.
And at that, thank you.
That's
Megan. Are you about to drop a mic and leave? No,
I can stay on for a bit longer.
All right, that's great. Stay with us in that case, because there may be more questions coming up in terms of testing and tracing. And if you have a question on that and you're watching this right now, Tony Moretta is the program director. It's not the first time he's been a director of programs, I think, but that was in radio. But program director of testing and tracing, and I'm going to get this in the wrong order, but I'm going to try it once again. It's the group director of policy. For government is Dr. Megan Mathias. Megan, the one thing we have seen is level 3 move in this week, and yes, there's already been talk of level 2. But before we get to that stage, in terms of level 3, and you've gone through some of the general policy that we're seeing there, and we're already, we've heard the announcement at the press conference today. Smaller shops are now going to open. One question we got at Chamber a great deal is why the big businesses first and then the small businesses second. There was obviously a good reason for that.
So overall, level 3 is a package of small changes that we can start to take that enable us just to see whether then the increased levels of social contact that it triggers off then leads to an increase in cases and so on. So it is this tentative stepwise approach that the WHO recommends, and we, along with many, many other jurisdictions, are taking. So the specific point about larger and smaller retail was, again, one point was about phasing, always taking that sort of the strategic public health aim into account. The second was very pragmatic about ensuring there was time to prepare. And I know that colleagues in Jersey Business have been doing a lot this week to try to support smaller retailers in the preparations to open. So it's really just part of that phasing approach.
That preparation is so important, and we've been talking quite a lot about that this week within Chamber and with lots of members in terms of the preparation they need to be thinking about, and it's a checklist, isn't it? It's a set of guidelines and a checklist of, have you considered this? Have you done that? And it's right down to the markings and the sanitizer and the posters and all that sort of thing. So that's a really important stage, isn't it? And it's quite a long stage in terms of prepping when you haven't been open for 6-7 weeks.
Absolutely. Important to say that I am not a medical doctor when I'm talking about this sort of stuff. So if there are complex questions on it, I will call a friend, if you like. But yes, absolutely. In thinking about returning to premises that have been closed, then every business, every organisation does need to go through that risk assessment using the guidance to think about how the premises can be opened safely for staff and customers. And of course, not just with regards to COVID-19, though it's been my kind of focus 120% of the time for the past 2 months and many others. You've got to think about the risk of Legionnaires in buildings that have been left for 2 months, for example, and all of the other health and safety measures that you would usually take. It's just that level again for the guidance that we've now put out to help prepare for the additional hygiene measures, which are sensible hygiene measures, just up a notch, really, in terms of enabling hand washing, enabling surface cleaning regularly between uses, avoiding sharing of equipment where possible, cleaning it down between sharing of equipment. These are all, when you take them individually, fairly straightforward measures. It's just putting them into a package and actually putting them into practice in day-to-day operation.
One of the areas that is opening, and we have seen, I think social media came alive with this, is the al fresco and the area and the opportunity to go and dine. And of course, if you dine, you can have a beer or a glass of wine outside somewhere. The weather's been a little bit chilly for it so far, but it's looking like a warmer weekend. There have been many who have been really, really appreciative and loving this, and there have been a few that have been a little bit cautious and very nervous, and actually watching very carefully that people are observing all the right rules. It's a really tricky one, isn't it?
It is, and we have to navigate it together. A public health strategy succeeds if the vast majority of the population willingly work together to protect each other. And so for those who feel a bit more cautious, that's okay. You can begin to allow those that are a bit bolder to take advantage of these services early, and for us, it's part of that stepwise approach. If the volume increases slowly, it enables us to see if there are any cases, and then of course we trigger into testing and tracing should there be any individual cases or even any clusters that do appear as the social contact increases. So it's part of the reason, part of the value of the lockdown and the cost and the pain that has caused has been to enable us to get this capability up and running in terms of Tony's area now, but also of course the preparations in the hospital, the Nightingale wing, and so on and so forth.
It does sound like it's a bit of a jigsaw. And from a group director of policy, you're looking at testing over here, you're looking at the economy on one side. Obviously, health is running right across all of these, and probably and rightly taking precedent across all of these because we're doing this in a safe measure. But it is a jigsaw.
It's a great analogy. I think really important to say that we are trying to put forward a public health strategy that takes a balanced view of the harms. It's not just a COVID suppression strategy. We do recognise that the lockdown measures particularly have had significant harms. We can see that the rate of adult protection notices has gone up. We can see that the rate of domestic abuse reports has increased. There's of course the enormous economic damage that's made. So ministers under medical advice, supported by the public health team, are trying to navigate that course between what the balance of harms, or put it the other way, the safest benefits that can be achieved step by step over the coming months, and the real concern that it's really difficult when you start on a stepwise approach. That of course everybody agrees in theory that a stage approach is good until you're not in the first stage, and I do understand that. it's that the flip side from a public health point of view is that if we run too quickly and we have cases that get out of control, we'll have to shift back into much more stringent controls again, and that would, we believe, be much worse on all fronts. Yeah. So it's as fast as safely possible.
I'm bound not to get through at least one Q&A with anyone without talking about some of the areas that can't open as yet. And I assume that you're looking at these, and one of them is health and fitness,
yep.
which is one of the first to close and probably one of the last to open again. So there's concern there. And of course, the hairdressers, Tony and I don't need to worry about them as much, but some people do. What am I saying, Tony?
I'm off. Right, bye.
Oh, I've upset him already. So in terms of those types of places, are there plans in place? Are you looking at the technical of how you can overcome that?
Before I answer that directly, I think it's really important to say we're fully aware that those sectors are also quite fragile sectors. There's a lot of self-employed people in the way that the hairdressing sector is structured, same for personal fitness and so on. So we really recognise that there are a lot of people who struggle and weren't making huge margins in the first place. From a public health perspective, of course, it's the higher risk environments that are most complicated to open safely. And that's why they are in level 2 at the moment. So to get to your point directly, we have started to talk to with Jersey Business, to some businesses, to Jersey Business and some businesses in the sector on potential measures for hair and beauty salons and what we calling close personal contact services, with the intention that I think colleagues across business have been understanding that when it came to level 3, we opened with the guidance on the day. We would much prefer, with time, to be able to have guidance produced well in advance so that preparations can be made well in advance. But for level 3, the choice was would you delay the start of level 3 for that, which we thought would not be a popular choice. So it wasn't ideal. And the more that we can do to develop the guidelines with industry and to produce ones that are going to work, because that's what matters, and to have them ready in advance and people knowing how they're going to open and being able to not just prepare a plan, but get all of their staff ready and perhaps the kit that they'll need, the better. So we have started those conversations for level 2. But as you will fully appreciate, we've had a Monday and Friday of this week on level 3 announcements. So that is in its early stages.
What's taking you so long? Joke. Tony, one question that did come in was you mentioned earlier about testing and about staff, and I've only got a couple of minutes left. And the question was, have you got enough staff, or is this now a recruitment drive to get more staff for testing? Because presumably you've grown like Topsy over the last couple of weeks. And will do next week.
You talking about me personally, or I know I've been binge eating, Murray. But
you and me together. Yeah.
So we've been very fortunate. We've been able to draw upon a lot of staff in the health service, in terms of, because you have to, for swabbing and testing, it has to be a healthcare worker who does that. We've seen some great support from all sorts of different organisations. There have been civil servants that have redeployed around the organisation. It's not just the likes of me and others from the arm's length organisations. I said 2 of my team have already been seconded in as well. And we're recruiting other people as well. I think the contact tracing team have been recruiting people in. I do wonder sometimes whether we're going to solve any unemployment problem by having an army of swabbers around the island in future as testing expands. But we're okay at the moment, but only because I think of a lot of hard-working public servants across health, civil service, and others. But we probably are going to need additional staff as things expand even further.
Right. Well, I know you'll be updating people over the next week with everything that's going on, and some of that detail that you've shared with us today. I'm extremely grateful. Megan, just before you go, someone had just put a very quick question in, which was about an organisation that falls under other leisure businesses and venues.
Yes.
that offers islanders an opportunity to enjoy the open space and is able to open observing physical distancing, can it also open associated indoor retail offering now that retail is open from Monday?
Yes, it can.
Yeah, well, there you go. See, that's the nice kind of short answer that I'm always seeking and never get. But that's terrific. Thank you for that. Thank you both very much indeed. Just to recap, Tony, I'm just going to, I think I've got all of this right. Testing probably going up to about 8,500 over the next 3 weeks. Could be, and these will be essential workers, healthcare professionals, people who work at hospice, police, fire, ambulance, those type of people, bus drivers maybe at some point later, and 5,000 tests per week is where you could be aiming to get to.
Yeah, so just to save you summarising that for your members, there is going to be, I think, a press release coming out imminently, possibly in a couple of minutes, from government along those lines. So you heard it here first, literally.
Thank you very much indeed for that. Thank you both for joining us. We managed to get in and get out before 5 o'clock. We appreciate everyone spending some time with us today. And we particularly appreciate you, Megan, and you, Tony, joining us today. I hope it's been helpful for everyone. Have a good weekend, both. Thank you very much indeed.
Yeah, you too, Murray. Thank you. Bye-bye.
Cheers.